Hello, my name is John Flutter, and I want to introduce myself and the training program in the etiology of malocclusion. I graduated as a dentist in London in the 1970s and went into general dental practice, where orthodontics was a regular part of general dental practice. After 5 years in London, I moved and drove to Australia, where I set up in dental practice. General dental practice was there for another 25 years. And on the way, I bought myself a medical Nikon camera, which enabled me to get some photographs of some of the early work that we did, even though we had to put up with colors that changed a lot with the photography that was available at the time. And one of the things that I did in Gladstone is I set up what I called a tooth fairy's house. It was an area where we introduced ourselves to the children to try and establish a pediatric section within the general dental practice. And as a result of that, I started looking at craniums and cranial growth in detail, and was working with appliances that were called trainers in those days to help children to develop arch form, and worked on that for many years, and then subsequently moved to Brisbane, where I set up a general practice really, and treating just dentofacial orthopedics, and was trying to develop programs and systems to help children to integrate myofunctional orthodontics into their lives. So we discovered different ways of delivering the program, different ways that worked and different ways that didn't work, and over a few years put together a program that we started teaching throughout the world. And the programs that I learnt, I've delivered in some 80 different countries throughout the world, and enjoyed myself doing that, and looking more and more about the effects that growth and development malocclusion has on sleep-related breathing disorders, temporomandibular joint dysfunction, and head pains. I now have a training practice, dental practice and training center in Kiev, and I went there earlier this year, went there last month. And in the training center, we've been developing systems to deliver myofunctional orthodontics, using various appliances, but including MyoBrace. And we have trained staff, we have orthodontists trained to do myofunctional orthodontics, and from that we have developed training schemes that we've introduced just last month in Ukraine. So if we see a patient with an upper jaw like this, a young child in the mixed dentition, then making a top jaw bigger is not that difficult. And we do that very often with expansion appliances. I'm old school, I use removable appliances. But whatever appliances we use, what we're doing is making room for the tongue in the roof of the mouth. So it's step one of a step two process. And the step two of the process is completed by training the child to keep their lips together and the tongue in the roof of the mouth. And I've been doing this treatment like this now for some 35 years, and have been teaching it throughout the time. And when we a couple of weeks ago, we were in Dnipro, and they delivered the same material to a group of orthodontists from Dnipro. And what I'm trying to do is to try and relate the two different concepts. One is that malocclusion is an unfortunate genetic accident that results in jaws that are imbalanced and teeth that are irregular, as opposed to another concept that the craniofacial development is under environmental influences, which can be influenced early in life while the child is still growing. And then by getting the orthodontist to look at the children, I felt that was quite a breakthrough, to take the focus off the study models and the cephalometrics, and to try and focus more on the child themselves and their cranial growth and development. The following weekend we held another lecture series in Kiev, which was equally well received, and that was in conjunction with an osteopath. And the following weekend, obviously, we were due to present the same material in Lviv, but the trip was cut short, and I'll tell you how I exited Ukraine maybe in another video later. But what we're trying to do is to try and identify the environmental factors that lead to poor cranial growth and development. And in particular, we're looking at lip and tongue posture. And we know lip and tongue posture is really difficult to measure. But just because it's difficult to measure doesn't mean that it's not an important factor in the growth and development of the cranial bones, particularly the nasal bones, particularly the nasal airway, and by extension, the position of the maxilla within the cranium and the pharyngeal airway. This is just an introduction about me and the sort of work that we're teaching in a series of videos following on from this. Thanks very much and look forward to seeing you again in the next video.